Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hey, everyone. Welcome back to another episode of the Friendly Pharmacist podcast. I'm your host, Nario Cantu, and today we're diving into a fascinating topic that's transforming the way we think about medications, pharmacogenomics. So now before your eyes glaze over from that long word, stick with me. I promise this is one of the most exciting developments in pharmacy and medicine today, and it could very well impact you or someone you love. So let's break it down. Let's start with, what is pharmacogenomics? Try saying that 5 times fast. It's a blend of pharmacology, the study of drugs, and genomics, the study of our genes. In simple terms, it's about how your DNA affects how your body responds to medication. See, we all process drugs a little differently. Some people break them down super fast, others super slow. For some, a medication might be a lifesaver, and for others, the same drug could cause side effects, not work at all. Pharmacogenomics helps us predict that response before the medication is ever taken. So why does this matter? Let me give you a real-life example. Imagine 2 people take the same antidepressant. One feels better in a week, the other feels absolutely nothing, and maybe even develops side effects. With pharmacogenomics, we can look at a person's genes and know ahead of time which medications are more likely to be effective and which ones might cause harm. This is personalized medicine at its finest. Now let's find out about how does it work. It all starts with a simple DNA test, usually a cheek swab or saliva sample. Once that's analyzed, we get a report showing how a person's genes impact certain enzymes in their liver, like cytochrome P2D6 or cytochrome P2C19. These enzymes are responsible for breaking down many common medications. If your body breaks down a drug too slowly, it can build up and cause side effects. If you break it down too fast, it might not stay in your system long enough to work. Pharmacogenomics gives doctors and pharmacists a genetic map to guide medication decisions. Now you may ask, where is this used? Pharmacogenomics is already being used in areas like psychiatry for antidepressants and antipsychotics, cardiology blood thinners like clopidogrel, pain management for opioids like codeine, oncology for targeted cancer treatments, and the list is growing every year. So now, what's the pharmacist's role? As pharmacists, we're perfectly positioned to help interpret pharmacogenomic data. We know how medications work, and we understand drug interactions, dosing, and side effects. When we combine that knowledge with a patient's genetic profile, we can optimize therapy like never before. This isn't the future. It's already happening. Some community and specialty pharmacies are even offering pharmacogenomic testing services today. The bottom line, pharmacogenomics empowers patients. It gives healthcare providers a clearer picture of how to treat each person, not just the average person. So instead of trial and error prescribing, we're moving toward precision prescribing, using science to get it right the first time. If you've ever said, this medication just doesn't work for me, or I get every side effect in the book, this field might be your answer. Thanks for tuning in to the Friendly Pharmacist podcast. If this topic sparked your interest, talk to your pharmacist or provider about pharmacogenomic testing. And as always, stay curious, stay informed, and stay friendly.